So to begin this body scan practice, simply feeling all the points of contact between your body and the floor, the mat, the surface you're lying on, back of the head on the pillow, the neck, the shoulders, upper back, middle back and lower back, the waist, the buttocks, the hips, and the legs, the backs of the legs. If you have a pillow behind your knee, the contact on the pillow, the lower legs, the calf muscles, and the heels and the feet, feeling the contact on the mat. Giving up the whole weight of the body, letting the body be heavy, letting everything soften, melt away into the earth. Softening, melting, feeling the contact with the floor and the earth beneath us. The earth perfectly capable of taking the full weight of the body. No need to hold or resist, just letting everything fall away, be soft. Giving up the weight of the muscles, letting the legs and arms be heavy. The contact of the lower back and back on the mat. And now bringing our attention to the breath, noticing how we are breathing. The chest, the thorax, the torso. The rising and falling of the chest, the movement. And the rising and falling of the abdomen with the breath. Breathing in, ribs expanding, lungs filling on the in-breath. Letting go, lungs releasing, falling back to the earth as we breathe out. Any tension, letting go on the out-breath. And now bringing our attention to the face, the head, and the face, the whole of the face, feeling any sensations in the face, temperature of the face, the tone, the texture of the skin, the stretch of the skin on the bones of the face. Coming to the mouth, letting the jaw be slightly open and noticing any tightness or tension around the muscles of the mouth and the jaw. Muscles that are used for eating and talking. But making the most of this opportunity just to release, letting any tension drain away downwards towards the earth. The two sides of the jaw, the sides of the mouth. Letting the tongue be soft in the mouth. The teeth, the lower teeth, the jawbone, the upper teeth, and the roof of the mouth, the hard palate of the mouth. From here coming up to the cheekbones and the nose. The area below the eyes. And now the eye sockets themselves, the eyes, the eyeballs, the muscles around the eyes. Letting the eyes be soft in their sockets, letting the eyes sink back. And also allowing the inner sense of sight to be quiet, not straining to see with the mind's eye. Noticing any tension around the muscles of the eyes, letting it go. The eyebrows, the area above the eyes, and the forehead, the broad, smooth expanse of the forehead above the eyes. Imagine smoothing out from the middle to the outsides of the forehead. From the middle of the eyebrows, the space above the nose, smoothing out to the edges of the outside. And from the forehead, we go to the hairline and the top of the head, coming up to the top of the head, and the ears, and the sides of the head, and the back of the head. Letting the head be heavy on the pillow, feeling the contact of the head on the pillow. And especially the area at the base of the skull to the neck, where the strong muscles of the neck support the weight of the head, the occiput. Letting this area be open, imagining a sense of length at the base of the head, the base of the neck, the base of the skull. The head heavy on the pillow, giving up the entire weight of the head to the earth. Giving up a little bit more. Feeling the head is heavy. The head is very heavy. Maybe 3.5 kilos. Giving it up to the earth. And the muscles at the top of the neck muscles attaching to the back of the head. Just noticing that. Any tightness or discomfort, allowing it to soften, allowing it to melt away. And the breath, breathing in, breathing out. From the neck, the back of the neck, coming round also the muscles below the jaw, the muscles that move the mouth open. These go to the front of the throat, the area around the thyroid, the Adam's apple, thyroid cartilage. Allowing the throat to be soft and open. Sometimes there's tension in this area, any tension around speaking, thinking of something we might want to say, or possibly regret for something we have said. Letting it go. Allowing the throat to be soft and open. No obstruction, no blockage of energy in the throat. Just noticing, noticing. From the throat coming down to the front of the chest, the area between the collarbones to the outside, and the chest and the lungs, and the heart area, the front of the chest. Just noticing this area connected with emotion, as the throat can be the expression of emotion. Coming down the front of the chest, noticing the breath. The ribs rising, the upper ribs rising up on the in-breath, releasing on the out-breath. Noticing any tension that we may hold in the chest and these upper ribs. From here, coming out to the shoulders, I'll talk down both arms, but you might find it easier just to focus, bring your awareness to one side. I'll leave it up to you to choose which side is the one you want to start with, but I'll talk through the arms. To the fronts of the shoulder, feeling the shoulder muscle, and then the upper arm, the area around the biceps, the front of the upper arm, and that goes down to the elbow, and of course the sides and the back of the upper arm, and the backs of your arms might be in contact with the mat. From the shoulder to the elbow, feeling the bony quality of the elbow, and then the forearm, allowing the forearms to fall out of the elbows. The backs of the forearms, feeling the skin, the tension around the skin, and the tone of the muscle. And if there is any tightness, we get kind of tennis elbow symptoms here, tendinitis, when the muscles become chronically short or tight. If we use the keyboard a lot, or driving or keyboarding, then these muscles, the backs of the forearms, can shorten. But for now, just letting them rest. Backs of the forearms and the front, noticing the difference, the feel of the forearms, noticing any contact with the surface you're lying on. And from the forearms to the wrists, the fronts of the wrists, and the backs of the wrists, backs of the hands, the skin of the hand and the tendons, and the knuckles, and the backs of the fingers, and the fingertips, and the fronts of the fingers, noticing the different feel, different quality. And the skin of the fingers, the front, and then the palms of the hands, the thumbs, the web between the thumb and the index finger, the whole of the hand, noticing any tension or holding in the hands. Sometimes tension in the hands can be the mind reaching for the future, or perhaps holding, clinging to the past. So for now, letting go, letting it be just as it is, letting the hands be soft, allowing them to be just as they are. From the hands to the wrists, the fronts of the wrists, and from the wrists to the forearms, the fronts of the forearms, this area, this tender area, the fronts of the forearms, to the elbows, backs of the elbows, and the upper arms, and the upper arms to the shoulders, and the whole of the arms, from the shoulders to the hands, heavy, giving up any muscle tension to the earth, resting, and the breath. Breathing in, breathing out, chest rising on the in-breath, falling on the out-breath. The area at the top of the back, the shoulders, and the upper back. These muscles of the shoulders and the upper back, they can work a lot. Head forward position, sitting, driving. But for now, just feeling the contact, the support, the warmth of the mat, the surface we're lying on, and the broad expanse of the upper back, and allowing these muscles around the upper back and shoulder blades just to be resting, letting go of any tension or holding, softening with the out-breath. Noticing that we also breathe in the upper back and the back of the ribs, as well as the front. From the upper back we go a little bit lower, the middle of the back, the area below the shoulder blades, this mid-section of the back. And the sides of the ribs, and noticing movement here too with the breath. There is a slight movement, ribs opening, ribs releasing. Follow the rib cage round to the front, and we have the lower ribs, that area below the sternum and the front. And then we have the abdomen beneath that, feeling the tone of the skin at the front, the pull, the texture of the skin. From the sternum and the ribs coming down towards the navel, towards the front of the body. And the area around the navel, the abdomen. And the abdomen goes down towards the pelvis as well. From the umbilicus, the navel, going round to the sides and feeling the contact directly behind the navel, which is an area below the kidneys. The lower back. The lower back may be in contact with the mat. So just feeling the warmth, support, this solid, strong area of the lower back. And people often have pain in the lower back, so for now just letting it be, allowing all the muscles to release, letting it be heavy, feeling the connection with the earth through the surface that we're lying on. Everything melting, draining away into the earth. You may also be aware of the pulsation, the pulse, the abdominal aorta, big blood vessel, artery that comes down from the heart, down through the abdomen. In fact, you could feel the pulse anywhere on your body. Feeling the navel, the abdomen, feeling the lower back in contact with the mat. The abdomen, the core of the vital energy of the body. And from the lower back to the sacrum, this broad triangular bone at the base of the spine, and the sacrum in contact with the surface you're lying on. Feeling the solidity, stability of the sacrum. From the sacrum going out to the buttocks, the fleshy, big muscles of the buttocks that support the weight of the body and used in walking and running and moving. Going around to the front of your pelvis, we have the front of the hips and the area of the groin as well. And between the genitals, the anus, we have the pelvic floor muscles. We all have pelvic floor muscles. Just feeling that area. This is the base chakra. And the legs falling out of the pelvis, being aware of the big muscles of the thighs. I'll go down both legs together, but you may wish to do one leg if you find that easier. The backs of the legs, the hamstrings, feeling any contact with the legs on the mats. They're going down towards the knee, if you have a pillow behind your knees. The fronts of the thighs, the big muscles of the front, the solidity, the strength. They're very strong muscles, some of the biggest muscles in the body, the fronts of the thighs, the tone of these muscles, the texture of the skin. Noticing how they taper down towards the knee, and they join into a common tendon that crosses the kneecap. The kneecap is actually in the middle of the tendon, and it joins onto the upper leg. Feeling the kneecaps, the fronts of the knees. From the fronts of the knees, we have the backs of the knees. The hamstring tendons from the backs of the thighs, if you sense the contact there on the pillow, to the backs of the knees. On the outside of the backs of the knees are these tendons of the hamstrings. And they cross below the knee and become the calf muscles, the fleshy calf muscles. The backs of the lower legs. And the calf muscles in turn taper down to become tendon, and that joins to the heel. Fleshy muscle area at the backs of the lower legs, but of course at the front, feeling the fronts of the knee, and below the knee we have the shin bone area, far more bony. There's a little muscle here on top as well, but you may feel this is bone. The shins, the fronts of the legs, and the sides of the legs. And going down to the ankles, the fronts of the ankles, and the sides of the ankles, and the back to the heel, and the front of the foot, the top of the foot, the dorsum of the foot, from the fronts of the ankles to the fronts of the foot, to the toes, feeling the skin at the front of the foot, the top of the feet, tendons inside the foot, and the big toes, and all the toes, and the toenails. From the big toes on the inside to the little toes on the outside. Paying attention to the toes. And then the underneath of the toes and the ball of the foot, the soles of the feet. And the underneath of the feet, the undersurface of the feet, and the arches of the feet on the inside, the inner side arch, the longitudinal arch of the feet, coming up underneath to the heels and the undersurface of the heels, coming up on the inside from the heels to the inner ankle, and the inner ankle coming above the ankle to the inner part of the tendon and the calf muscles, the whole of the feet and the whole of the lower leg coming up the inside. There's a space between the bone, the shin bone, and the Achilles tendon and the calf muscle, coming up both legs to behind the knees and the knees themselves and the backs of the knees and the inside of the knees. And above the knees we have the big strong muscles of the thigh, hamstrings at the back, and the adductors on the inside. From here we come up into the groin, the middle part of the body, and back to the pelvis. The legs heavy, the legs falling out of the pelvis. Hips relaxing, giving up all the weight of the legs to the earth. Heavy, solid but soft, heavy, releasing on the outer breath. Noticing any tension, any areas of discomfort or pain, and not holding on to that, but softening with the breath. Coming up from the pelvis to the abdomen and the belly, the front of the abdomen around the navel, and the chest, and the ribs. Noticing the area of the diaphragm between the abdomen and the chest, and the expansion and contraction of the ribs. And the lungs inside the chest, creating the movement of the ribs. And the back, the broad expanse of the back, and the connection, the contact with the mat and the earth beneath us, feeling the whole support, stability of the earth and the surface of the back, the length of the back, the breadth of the back, from the lower back to the middle and the upper back and the shoulders. And the shoulders and the upper arm and the arms falling out of the shoulders. Heavy, releasing to the earth. Coming up to the throat soft and open, and the neck and the head heavy on the pillow. Giving up all the weight of the head to the earth. Whole body at one. The head heavy on the pillow, shoulders, chest and torso, lower back, waist, pelvis, legs. The whole body being breathed by the breath. Allowing sensations to come into being and pass away, moment by moment. Noticing how we sometimes may want to cling on to the more pleasurable sensations, warmth, comfort and pleasure, and how we may push away or reject the less comfortable, the painful sensations. But just noticing this and allowing everything to come into being, feeling it, and then pass away and move on. Everything is constantly in flux, changing. The body is more fluid than we than we realize. Letting all these sensations arise and come into being and fall away. Giving up the whole weight of the body to the earth beneath us, perfectly able to take our weight. Giving up all the tension, letting it drain away into the earth, supporting us. And the breath. Breath is always there. We may have a sense of breathing in, breathing out through every pore of the skin, the whole surface area of the body. 360-degree breathing. Softening with the out-breath. Giving everything up to the earth. Allowing sensations to come into being, pass away, moment by moment. Everything fluid, always changing, never staying the same for very long. Now, very, very slowly, we are going to begin to bring this Bodyscan meditation practice to a close. Maybe taking a few deeper breaths, paying attention to perhaps feeling the contact of the skin, the clothes on our skin. The fingers and the toes, perhaps making small wriggling movements with the toes and the fingers, which is a way to speed up the brain frequency. If our brain wave is more of a alpha wave or delta, we begin to activate it a little bit more. Particularly the hands and the fingers. A lot of the cortex of the brain is devoted to the hands especially, and the face and the mouth, speech area, tactile sensation. Wriggling your fingers, your toes, perhaps the whole hand to the whole feet, small stretching movements, and the wrists. You may want to make small movements, rotations with your wrists and your toes, and if you're lying on your back, perhaps soon bending your knees, maybe one knee at a time, very mindfully. You don't make rapid movements, but very mindfully, with full attention, bending one leg and then the other, putting one foot and then the other onto the mat. This allows you to make a little more movement in your pelvis and lower back. A small wriggling movement. You might also want to stretch with the arms. Just allowing your body to do what it needs to do. It will know. The body has a wisdom far greater than we acknowledge. It knows what it needs to do. And if you're lying on your back, then turning onto one side, perhaps pushing yourself up to a sitting position on one hand and one elbow. You may find a good way to get up to standing is to turn on to all fours, a kneeling position, and then slowly standing up. This is the end of this Bodyscan practice, but taking this sense of equilibrium and connection with the body into our activities for the rest of the day.